Hello guys, welcome to my live stream. Yeah, welcome. My name is Beatrice. I'm a certified natural family planning expert. So today we're going to be talking about family planning and birth control, the way they affect your life, the way they affect your health. People say family planning and birth control. You're welcome if you're just joining us. Please tell us your name and where you're watching me from. Thank you. So people see family planning and birth control as, one of those things that people do every day. But in actual fact, natural family planning and birth control affect your health. They affect your life. So you need to be careful the method you choose, because every couple, whether married or not, are into one family planning method or the other. So you need to be careful the kind of family planning method you use, because whatever method you choose to use will definitely affect your health, affect your life, and affect everything about you. So family planning is divided into two, namely the natural family planning and the artificial family planning or birth control. Some people call it birth control, some people call it family planning. It all depends on what you want to call it. Natural family planning consists of the old rhythm and calendar method. The old rhythm and calendar method, that is when a woman counts her fertility, counts her dates with the help of a calendar. If you are just joining us, you're welcome. Welcome. The topic is natural family planning, and the topic is family planning and birth control method. The way they affect your life, the way they affect your health, and everything about you. So people think family planning is just one of those things. They think it's just an everyday, what you just have to do, without even putting into consideration how it affects their health. The kind of family planning method you use affects your health and affects everything about you. So like I was saying, family planning is divided into, or birth control is divided into, namely the artificial birth control or family planning and the natural birth control or family planning methods. It now depends on the one you choose. Your health depends on the one you choose. Now, the types of natural methods are: number one, the old rhythm and calendar method. The old rhythm and calendar method is when a woman counts the dates of her fertility on a calendar with the help of a calendar. It is a natural method. The second one is the thermometer method, also known as the BBT method, temperature method, where a woman checks her temperature with the help of a BBT thermometer. There's a special thermometer for it, a special kind of thermometer known as the BBT thermometer. The third type of natural family planning method is the Billings ovulation method, which is when a woman observes her mucus, her cervical mucus, her, what comes out of her body every day, just to track her fertility. That is the Billings ovulation method. There's another method also known as the love and life method. The love and life method is directly derived. Hello, Juliana. You're welcome to my live stream. So the love and life method is directly derived from the Billings method, but with just slight differences. And then another natural method is also known as the Symptothermal method. The Symptothermal method is a combination of the calendar method, the thermometer method, the Billings method, and the love and life method. The symptothermal method makes use of all the natural methods, and it is highly effective. It is like 100% effective when done correctly. Now, there's another method, other natural methods are the Marquette Method, the 2-day method, and there's a new method, a new natural method, also known as the Lactational Amenorrhea method. Lactational amenorrhea is for breastfeeding mothers, for nursing mothers. So it has its rules and regulations. Lactational means your body is producing milk. Then amenorrhea means you are not bleeding, you are not seeing menses. So that is lactational amenorrhea. It is for women who have just given birth, but their menses hasn't yet returned. So that is what lactational amenorrhea is. Now, so much so for the natural methods. Now let's move on to the artificial methods of family planning or birth control, whatever one you prefer calling it. So now artificial birth control is also divided into, there's the hormonal birth control and the non-hormonal birth control. Hormonal birth control methods are artificial methods of birth control or family planning. This consists of the IUD, intrauterine device, also known as the coil. They used to call it coil, but now they call it the IUD because I think they changed the shape. It used to look like a mosquito coil, but now the shape has changed, so they call it IUD, intrauterine device. And then the pill, the oral pill, the oral contraceptive pill, the injection, also known as the Depo Provera shots. This one, you take it like every 3 months. You take the injection. Every 3 months, you go to the hospital to renew your injection. So it is taken every 3 months. Then there's the insert. There's the insert. It's like a matchstick, the shape of a matchstick, but it's made of plastic. It's done like it's like a mini surgery where you go to the hospital, and then it's always here. It's always inserted on the upper arm. They slit, they cut, they make a slit somewhere around here, and then they insert it, and then they sew it back. It is called the contraceptive implant. And then there's also the patch. The contraceptive patch is just like a plaster, the shape of a plaster, a tiny plaster that is placed on the upper arm or on any other part of the body except on the breasts. It is called the contraceptive patch. And then there is which other hormonal method? The oral contraceptive, the IUD, the intrauterine device, the implant, the injection, the pill, the condom. These are artificial ways of planning your family, but the condom is not hormonal. The condom is non-hormonal. So let's go to the non-hormonal. The non-hormonal is of course the condom, the copper IUD. This one contains copper, and it is done like a mini surgery. You have to go to the hospital, and then the doctor will have it implanted into the uterus, that is into the womb. It contains copper. And how does it work? Copper and sperm cells are not friends at all. Sperm cells hate copper. So when the copper IUD is inserted into the uterus, when sperm comes in contact with it, they just die off. It kills them. So that is how it works. The copper IUD, we have spermicides, we have the female and male condoms, we have the diaphragms, we have the cervical caps, we have the I've talked about implants before. So we have the more permanent ones known as the vasectomy. Vasectomy is for men Vasectomy is like a surgery that the 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 duct the duct that transports sperm cells out of the man's body is cut and tied up so that he doesn't so that during sexual intercourse sperm cells will not be able to come out or be released. That is vasectomy. It's a permanent kind of birth control method for men only. But I think these days there's reversal surgery. There's a reversal surgery that can be done. It's no longer permanent, but it's permanent. But if you don't want it any longer, maybe you are tired of the vasectomy or whatever, you can go back to your doctor and tell him to, to do it again, as in redo it, reverse it back to the way it was before. But there's no guarantee that it will work the way it used to. So that is vasectomy for men. Then for women, a permanent way of birth control for women is called tubal ligation. Another one is also tubal salpingectomy. Tubal ligation is when the fallopian tubes are cut or tied. Most times they are not cut, just tie them up so that the release of eggs, so that just to prevent the meeting of egg and sperm. That is tubal ligation. Tubal salpingectomy is the complete removal of the fallopian tubes. This is a very permanent method of birth control. So these are the types of birth control. There are many other types, but these are the widely used types I've just mentioned. I've mentioned the natural birth control, I've mentioned the artificial birth control, and I've mentioned that artificial birth control is divided in two, which is the hormonal and the non-hormonal. Now, like I said before I started, the kind of birth control you use can affect your health in ways that you never can imagine. The type of birth control or family planning you decide to use can affect your health, can affect your life in ways that you can never imagine. The best methods of birth control, put me anywhere, are the natural methods. Yes, they are the natural methods. Natural methods of birth control have no side effects. They have no side effects. They align, which means they work according to your natural body system. They blend with your natural body processes. While artificial birth control or artificial family planning works by force, like, let me put it that way, as in they force your body to do what they want. They force your body to prevent pregnancy by fire, by force. While natural birth control or natural family planning works in alignment, as in they work according to your natural processes. They are the most affordable. Natural birth control is not only safe health-wise, they are also pocket-friendly. They are affordable. They have zero side effects. Artificial birth control messes up your hormones, especially the hormonal birth control methods. They mess up your hormones. They cause different ailments that no doctor will ever tell you. Doctors always forget to tell us their side effects. I remember asking one of my doctor friends that, why is it that you guys don't tell women the truth about how all these pills and so on, how they work? He said they don't ask. That is what he told me. He said they don't ask. So because they don't ask, we don't tell them. Can you imagine? But the side effects are traumatic. The side effects of artificial birth control or artificial family planning can be traumatic. You want to be very careful what you put in your body in the name of preventing pregnancy. And these days, I hope you guys know that pregnancy prevention is no longer for women alone. There are now more than 8 different types of birth control for men as specifically designed to stop sperm production for men. So gone are the days when the headache, the stress of birth control or family planning lay heavily on women alone. These days, there are tablets, there are injections, there are different surgeries that are for men, specifically for men, in the name of birth control. So if a man tells you, if you are not interested in birth control or in artificial family planning, and your partner or your man is telling you, like forcing you to go to the hospital, go and have an IUD inserted, or go and get the injection, or go and do this, go and take a pill, go and do this. Tell him, say, Oga, there are birth control methods for men as well. You can go and do it. It is no longer for women alone. So that's what I'm trying to say. There are now birth control methods specifically designed for men. So that is that. And how do they work? Nobody, according to the doctor, like I was saying earlier on, I was asking a doctor friend that, what is it that you guys don't tell women the truth about how artificial birth control methods work? You don't tell them the side effects. You don't tell them the traumatic side effects of artificial birth control. Do you know what he said? He said they don't ask. And that is the truth. He said their patients don't ask. So for that reason, they don't tell them how they work. So let me state how they work. Let me state how artificial birth control methods work. Artificial birth control methods. Sorry. Hello, you're welcome. Artificial birth control methods work in 3 ways. Number 1 is that they stop ovulation. Artificial birth control methods stop ovulation. That is number 1 way they work. Without ovulation, there can be no pregnancy. So they force the body to stop ovulating. That is the first way they work. The second way they work is that they thicken cervical mucus or cervical mucus. It depends on how you mention yours, how you pronounce yours rather. They thicken cervical mucus. Cervical mucus is slippery. It is stretchy. It is fine in nature. It is fine in texture. So what artificial birth control does is that they make it thick. They make it so thick that it becomes a blocking agent, blocking sperm cells from being able to penetrate to get to where the egg is. That is the second way they work. The first way they work is that they stop ovulation. The second way is they thicken cervical mucus. The third way is that they scrape the uterus, the wall of the endometrium. The endometrium is the inside the wall, as in the uterus, inside the uterus. That is the endometrium. So your artificial birth control, which is the pill, the IUD, the insert, the patch, the injection, the Depo Provera shots, and the artificial birth control methods, they scrape the womb. And when the womb is scraped, it becomes too flexible for any pregnancy to survive in it. These are the 3 ways artificial birth control methods work, and their side effects can be highly traumatic, ranging from migraine to acne to loss of libido to depression to cancer, yes, to different types of ailment, to stroke, blood clots, name it. Your doctors always forget to tell you the side effects of the birth control methods they put in your bodies. And according to a doctor friend of mine, they don't ask. When I asked him, I said, why is it that doctors don't tell women the side effects of these birth control methods you guys use on them? They said, women never ask. You don't ask. That is what he said. And that's the truth. But right now, I have told you how they work. Now you know how they work. Sorry, I think yeah. So that is how they work. That is the way birth control or family planning can affect your life. So you want to be very careful the method you choose to use. Like I said earlier, natural family planning is the best. It has no side effects. It is the most affordable. It is the safest. It is just natural. It is highly scientific. It is natural. This is just the beginning of a series. This is just the first day of a series. I'm going to be talking in depth about natural birth control, artificial birth control, hormonal birth control, non-hormonal birth control, how they operate, how they work, their modes of operation, their side effects, and their safety, as in their success rates. How successful are they? How effective they are? That is what I'm going to be talking about in the next couple of days. I'm going to be talking about how success, as in their success rates, their side effects, their modes of operation, how they work, and their affordability, and their health, how they affect your health. Because anything that affects your health affects your life as well. So that's what I'm going to be talking in the next couple of days. Anything that affects your health affects your life. And birth control is one of them. Family planning is one of them. Family planning or birth control, they are both the same, whatever you call it. Either family planning or birth control. So whichever method you choose affects your health and by extension affects your life as well. So what are the success rates? What is the success rate of the calendar method? The calendar method is not suitable for everybody. It is also called the old rhythm method. It is not suitable for everybody because it works like on predictions. It is not suitable for women who have irregular cycles, women who don't see their right cycles regularly. The old rhythm or calendar method is not suitable for them because it entails counting your fertility on a calendar with the help of a calendar. You can't rely solely on such a method. No, you can't, because there are bound to be mistakes. You may have seen your period like on the 3rd of last month, for example. This month, it may not come on the 3rd. And if you use calendar, then there's bound to be mistake. You can't get it accurately. You can't get accurate results by counting the calendar. So how do you use the calendar method? You use it in combination with other methods. You use the calendar method in combination. You can use it in combination with the BBT method. That is the basal body temperature method. Basal body temperature. Basal means your body's temperature at rest. Your body temperature at rest. First, how is it done? It is done first thing in the morning. First thing in the morning, you check your temperature using a special thermometer. You don't use any kind of thermometer for this. There's a thermometer called the BBT thermometer. That is thermometer you use, just go to any pharmacy and tell them you want to buy the BBT thermometer. So how is it done? It is done first thing in the morning before doing anything at all. As immediately you open your eyes from sleeping, immediately you are awake, you take without even getting up. So it means that you have to have your BBT thermometer just beside you, maybe under your pillow or just on the lampstand beside your bed. So what do? First thing in the morning, before doing any work at all, before going through any type of stress at all, you take your thermometer and put it under your tongue, insert it under your tongue and leave it there. Make sure it's on 0 degrees. Make sure it's on 0 degrees. Insert it under your tongue and then wait for the click. There's a sound it makes when it's done, when it's ready. So wait for that sound. You bring it out and check your temperature. You do this every morning. Immediately you are awake, immediately you open your eyes before getting out of bed. That is why it is called basal body temperature. Basal means your body's temperature at rest. When the body is completely at rest, that is basal body temperature. So you do that first thing in the morning, every morning around the same time, not 6 a.m. today, 7 a.m. tomorrow. It doesn't work that way. If it's 6 a.m. today, it has to be 6 a.m. tomorrow. It has to be 6 a.m. the day after tomorrow, and so on. So that is the way to check your basal body temperature. You insert the BBT thermometer under your tongue. Make sure it's on 0 degrees before you start. Insert it under your tongue and wait for about 5 minutes or until you hear there's a clicking sound, or what do I call it? There's a sound it makes when it's ready. So when you hear that sound, you bring it out and check your temperature. The next day, you do the same thing. You put it under, you insert it under your tongue, wait for the clicking sound, and then you bring it out and check your temperature. You do that every morning, exactly at the same time. If it's 6 a.m. today, it has to be 6 a.m. tomorrow. Not 6 a.m. today and 7 a.m. tomorrow. No, it doesn't work that way. If you do it 6 a.m. today, you do it 6 a.m. tomorrow, you do it 6 a.m. the day after tomorrow, and so on. And whatever reading, you jot your readings. You have to get like a notepad where you jot your readings. You jot your readings every day. When ovulation occurs, a woman's body temperature is slightly higher. When ovulation has occurred, a woman's body temperature is slightly higher than on normal days. So and it stays high for about 3 days before it goes down again. Those 3 days means the 3 days after ovulation. Temperature gets higher when the egg has been released after ovulation. So when you notice that your temperature has become higher and stayed that way for about 2 or 3 days, you know that yes, this is the period, this is the time of ovulation. That is how BBT method works. So you are combining BBT and calendar method. You don't use calendar method alone on its own. No, it's not going to be accurate. So you are combining calendar and BBT to make it more accurate, to get more accurate results, and to be on the safer side. I hope my explanation is clear enough. And then to take it further, like people who do Symptothermal Method, they count their dates on a calendar. They use BBT method as in, checking their temperature every morning. Checking their temperature every morning. They do calendar, they do BBT, they do Billings ovulation method, Billings ovulation method is you observe your body signs. You observe what we call your body signs every day. You observe what we call your body signs every day. That is BBT method. Sorry, that is the Billings method, BOM, Billings ovulation method. The love and life method is directly derived from Billings method. Billings method is observing your body signs every day and noting them down, noting them on a notepad or on an app. There are fertility apps. You can note down your body signs every day. That is the love and life method or the Billings method. The love and life method is slightly different from the Billings method, but it is directly derived from the Billings method. They are very similar, but the love and life method has a few differences, and that is where it talks about achieving pregnancy and the pre-selection of the sex of your baby. Excuse me. Those are the differences between BOM and love and life, Billings ovulation method and love and life. Love and life is everything that the Billings method talks about and more. More in the sense that love and life talks about achieving pregnancy and the pre-selection of the sex of your baby. So that is what makes it different from Billings method. Every other thing remain the same. They are the same. So that's how to do that. So when when you do the symptothermal method, it means you're combining the calendar or old rhythm method, the BBT method, the basal body temperature method, the Billings method, the love and life method. You are combining everything. That is the symptothermal method. You don't want mistakes. You don't want stories. You don't want issues arising like unplanned pregnancies. Those are the people who practice the symptothermal method. It is highly effective. It is, let me say, 99.9% effective. It is completely natural. It is safe. Talking about health, it is very affordable. Talking about your pockets, it aligns with your natural body processes. It blends with your natural system. It doesn't force the body to prevent pregnancy like the artificial methods. All the natural methods do this. They don't force the body to prevent pregnancy like the artificial methods. They blend, they align with your natural body processes. So these are just the slides, as in a summary of the differences between the natural and the artificial methods of family planning or birth control, as you like it. Now, talking about the calendar method. The calendar method is a very old method of family planning. I have asked a couple of women that claim that swear by it. Let me put it that way. A couple of women swear by the calendar method. So please don't get me wrong. At first I was like, you cannot rely solely on the dates of the calendar to predict your fertility. For some women, they claim that it works perfectly for them. Why did I say that? Why did I say you cannot rely solely on the dates on the calendar to predict or to track your fertility? Because anything can happen. Anything can happen. Stress can change your cycle. I hope you know that. Medications can change your cycle. Age can change your cycle. Illnesses can change your cycle. So using the dates of a calendar to track your fertility can be, how do I put it? It can be dangerous. Yes, it can be dangerous because you could come up or emerge with unplanned pregnancies. Reason why I said use the calendar method in combination with any other natural method. You can be using the calendar, you can be using calendar and also doing Billings, for instance. You can do calendar and do Billings, combine the two to be on the safer side. You can do calendar and also do BBT. You're counting on the calendar and you're checking your basal body temperature to be on the safer side. You can do calendar and do love and life. Just combine it with other methods to make it more accurate, to get more accurate results, to be on the safer side, to prevent unplanned pregnancies. That is just the logic behind combining it with other methods. Now, you could have had like a 28-day cycle. In your last cycle may have been 28 days, for example. This is just an example. Your last cycle may have been 28 days, right? And then this month, you find out it is 30 days. It is 30 days. Last month it was 28 days. This month it is 30 days. If you have been using the calendar, how do you rectify that? How do you rectify that? How do you go about it if you've been using the calendar? So the calendar method is not reliable. It's not really 100%. Although some women swear by it, some women claim that it works, that it has always worked for them. But I don't advise that as a certified natural family planning expert. I don't advise you rely solely on the calendar method. Use it I've said it again and again. Because it is that serious, it is that important. I need to stress the need to combine it with other methods so that you don't end up regretting or end up confused. That is just so to speak. Yeah. Now, what are the disadvantages of the BBT method? BBT, the basal body temperature method. What are the disadvantages? It is highly effective if you know how to go about it. It is highly effective if you know how to go about it. But the disadvantages is that it doesn't tell you the days. It doesn't identify, let me put it that way. It doesn't identify the days leading to ovulation. It doesn't identify the days before ovulation. It only identifies the days after ovulation, which means that your body temperature rises after ovulation, not before ovulation. So, and pregnancy can occur days, as in pregnancy occurs at ovulation, right? It's a bit confusing. Let me make it easy for any layman to understand. Pregnancy can only occur when ovulation has happened, when ovulation has taken place. That is the only time pregnancy can occur. But the environment, I'm trying to use simple terms here. The environment, the reproductive system is favorable to sperm cells like days before ovulation. Days before ovulation, the woman's reproductive tract is favorable. The woman's reproductive system is favorable to sperm cells even before before ovulation occurs. So it is not um, every time you have sex, you have intercourse, that pregnancy occurs immediately. No, pregnancy can occur from intercourse you had 5 days ago. Yes, pregnancy can occur from intercourse you had 5 days ago, because the sperm cells can, because sperm cells can, they can survive under favorable conditions for up to 5 days. Sperm cells can live as long as the condition is favorable for them. They can survive for up to 5 days, which means that if the condition, the reproductive system is favorable, which means favorable means that you are now in your fertile period. I said that this is a series, it's an interesting series, so I'm going to be talking about everything fertility and family planning, birth control over the next, as in days and weeks to come. So please make it a date with me. I'm going to be explaining everything you need to know about fertility, the women's reproductive health, birth control, family planning, and everything about reproductive health for women. So please make it a date with me. So as I was saying, sperm cells can survive in the woman's reproductive tract when the conditions are favorable for up to 5 days, which means that you can get pregnant from intercourse you had 5 days ago. It is not, people think it's you have intercourse today, you must get pregnant today. No, intercourse you had 5 days ago can cause pregnancy today. Intercourse you had 4 days ago can cause pregnancy today. Intercourse you had 3 days ago can cause pregnancy today. So it doesn't necessarily have to be that instant. You understand? It doesn't have to be necessarily have to be that instant, or in that instance, as in immediately. No. So how do you go about it? How do you go about it? What was I even talking about before I started talking about like this? Yeah, I was saying that when the conditions are favorable, as in when it means that there's cervical mucus. Cervical mucus is also known as egg white. It is a slippery and stretchy mucus that goes to cement, goes to warm up the reproductive system of the woman. The woman's reproductive system goes to prepare the environment, make it safe, make it warm, make it inviting, make it favorable for sperm cells to survive. That is what the cervical mucus does. And so the woman has intercourse 5 days ago, but there is no egg. Ovulation has not occurred. The sperm cells will remain alive because of the presence of cervical mucus. Cervical mucus makes the environment favorable for the sperm cells to stay alive until the egg is released. So it is whenever the egg is released that fertilization can occur. And when fertilization is the meeting of the egg and the sperm, the fuse together of the egg and the sperm. And when fertilization occurs, we say pregnancy has occurred. And the resulting embryo is the baby. The result is an embryo. When the egg and the sperm meet, when they fuse together, the head of the sperm goes through into the nucleus of the egg and they fuse together. We say fertilization has occurred, resulting in an embryo. This embryo stays in the the female reproductive tract. And then series of cell divisions occur over time, over a couple of days, and the result is known as a blastocyst. This blastocyst is a combination of cells that have divided and divided and divided. Do you understand? So this blastocyst is what moves from the fallopian tubes to the uterus, where it has to implant, where it has to embed itself. And what happens when it gets there? Maybe the woman is using the pill, oral contraceptive pill, for instance. The embryo or the blastocyst gets to the uterus, and the uterus has been scraped by the artificial family planning method the woman is using. It can never implant. It will never be able to implant because the womb, the endometrium, is too thin. It is not thick enough to implant the baby. It is not thick enough to carry the baby. It is not thick enough to nourish the baby. Let me not call it a baby because it's not a baby at this point, although it's a baby in the long run, but it is called a blastocyst or an embryo. And when the embryo tries to implant and the implantation is not able to happen, what happens in the process? It just dissolves and comes out as menses. So that's the way it works. It just dissolves and comes out as menses. This is just a summary of how artificial family planning methods work. And most women don't know. Most women don't know all this. They just use family planning. Yeah, they're using family planning. They don't know what is happening inside their body. They don't know how they work. Their side effects are traumatic. Like I mentioned earlier, their side effects can be highly traumatic. So you want to be sure of what you're putting into your body. You want to be sure of what you are using in the name of preventing pregnancy. Yeah, you want to be sure, because whatever affects your health, affects your life, affects your family in the long run. So you need to be careful what you put into your body in the name of family planning or birth control. Now, we've really said a lot today. I've talked about, I just gave an overview. This is the beginning of a long series, because I'm in the next couple of days and weeks to come, I'll be talking about, family planning, birth control, their side effects, their modes of operation, and their everything, their success rates, their affordabilities, their effectiveness, name it, everything about them. I'm going to be talking about in the next couple of weeks. So I've talked about the calendar method. You have to use the calendar method in combination with another natural method, because the calendar method is like dangerous. Let me put it that way. It is dangerous to use the calendar method alone, as in on its own. It is not reliable. It is not reliable. It is very good, but it is not reliable. You need to pair it. Yeah, that's the word. You need to pair it up with other methods to be on the safe side. Then I talked about, I was like, why is it that the calendar method, why do I think that the calendar method, or why did I say that the calendar method cannot be used, cannot be relied on, is not reliable to be used on its own? This is because anything can cause a change, anything can cause a shift in your cycle, anything like stress, anything like illnesses, anything like medication, even age, anything at all can cause a change in your like menstrual cycle, and if you have been using the calendar to count, as in to calculate your fertility or to track your fertility, this can fail. This can fail when changes occur in the cycle. This can fail, and this can lead to unplanned or unwanted pregnancies. So you want to pair your calendar calculations with other methods like the BBT method, the BOM method, Billings ovulation method, the love and life method, the or like the symptothermal method. Yes, the Marquette method, whatever natural method it is, you want to pair your calendar methods, your calendar calculations with one or two other natural methods. And then I also talked about the traumatic side effects of hormonal birth control, how they affect your health and how they affect your life in the long run. I also talked about the fact that these days family planning or birth control is no longer for women alone. There are now over 8 different methods of birth control or family planning specifically designed for men. Yes, men are now in the game. Women are like, no, it's high, no, women are like, why should it be only us? Why has birth control laid so heavily on women over the years, over centuries? Birth control and family planning, the stress of birth control, the stress of family planning has been on women alone. So now we have, there are over eight methods of birth control and family planning methods that are specifically designed for men. Yes, for men. These methods stop sperm production, and when there's no sperm production, there can be no pregnancy. That is the way they work. And I talked about the more permanent types of birth control, the more permanent types of family planning methods, which is the vasectomy for men. I just gave a brief overview of how it is done, which is vasectomy for men. Tubal ligation for women. Tubal ligation is the tying up of the fallopian tubes. When the fallopian tubes are tied up, no egg or sperm will be able to meet, because the sperm and the egg meet in the fallopian tubes. And when the tubes have been tied up, this meeting is prevented, and that is tubal ligation. It is a permanent way of, or permanent method of birth control. Another one for women, and it is for women. Another one for women, another permanent method of birth control for women is the tubal salpingectomy. It is the complete removal. This one, we don't want stories. We don't want mistakes. So the complete removal of the fallopian tubes. That is, nothing can no mistake can happen here. No, what will I call it now? That maybe there was a tiny space, and that is how the sperm and the egg met. No, this one, complete removal, no mistake can happen here. It is called tubal salpingectomy. It is called the complete removal of the fallopian tubes. It is a permanent method of birth control. And then we also talked about the different types of hormonal birth control, which I mentioned. I'm just giving an overview, which is the hormonal birth control, the IUD, that is the intrauterine device, the shots, Depo Provera shots. There are also other kinds of shots, that the contraceptive shots. Yes, that is the correct name, the contraceptive shot, because Depo Provera is is a brand name. So it is not the only brand out there. So it is generally, they are called the contraceptive injection or the contraceptive shot. So we have the IUD, the contraceptive shot, the insert is like a tiny tube, the shape of a matchstick. It is done like a mini surgery where the woman is, where the upper arm is cut, a slight cut is made on the upper arm of the woman, and the insert is in the implant rather. It is called a contraceptive implant. It is inserted into that cut, into the upper arm of the woman, and then the cut is sewed by sutured. So always here, it's always here, somewhere here. That's the third example. The fourth example is the patch. The patch is like a plaster, like a tiny plaster that is also on the upper arm, also like pasted on the upper arm, on the, I think on the laps, on the thighs, but never on the breasts. Never on the breasts. It can be pasted or on any part of the body except on the breast. It is called the contraceptive patch. We have the diaphragm. This is also a hormonal birth control method. We have I've mentioned the IUD, I've mentioned the injection, I've mentioned the implant, I've mentioned the patch, I've mentioned which other one? The hormone, I'm trying to, the pill is the pill that, the tablets that women take just to prevent pregnancy. Their side effects can be traumatic, yes. They all work the same way, but they come in different shapes and sizes. All these things I've mentioned, pill, patch, implant, IUD, this and that, once, as long as they are hormonal, they have the same mode of operation. They work the same way, but they come in different shapes and sizes. They all contain artificial estrogen and artificial progesterone. That is what they contain. Our bodies make these natural hormones. Our bodies produce these natural hormones, namely estrogen and progesterone, but these artificial methods contain the artificial, that's why they are called the artificial methods. They contain the artificial estrogen and artificial progesterone. And I also mentioned that there are other types of birth control. I also mentioned that there are other types of birth control. There are other types of birth control that are not hormonal. We have the hormonal birth control, we have the non-hormonal birth control. That is, these two are under artificial birth control, while the natural birth control stands on its own. Artificial birth control is divided in two, and that is hormonal birth control and non-hormonal birth control. I've talked about the hormonal birth control. Now the non-hormonal birth control is the spermicide, the condom, the withdrawal method, the female condom, male and female condom, the sponge, the cervical caps. These are non-hormonal birth control methods. So keep a date with me. This is just the beginning of a series. Don't worry, next time I'll just try to make my audio more audible. I'll try to make my voice more audible, but this is just the beginning of an interesting series where I'm going to be talking about birth control, family planning, their modes of operation, their side effects, their success rates, their affordability, what they do to your health, how they affect your health, how they affect your life in general. Because whatever affects your health also affects your life in general. So that is what I'm going to be talking about in the next couple of weeks and months to come. So join me, make it a date with me, and that will be goodbye. Yeah, wow, we've stayed up to an hour already. That will be goodbye from me for now. If you have any questions, do well to drop them in the comments. and I'll be always ready to answer your questions. Bye for now. Thanks for watching and bye.